stop the bleeding, try to take care of the pain and suffering, and this potential loss of life from bleeding to death from the cancer. Can we treat people who have had standard radiation before? That was her and her son's big question. The answer is yes. Radiosurgery allows that, and we have probably the largest experience in the world retreating patients who have had standard yet ineffective prior treatment, whether that's chemo, surgery, or radiation. So if you're in the category, and we know there's lots of listeners out there who have had cancer or who have cancer or their loved ones have cancer or friends have cancer that just didn't work, standard treatment didn't work, and experimental treatment, well, we know experimental treatment doesn't work for the vast majority of people. So give us a call, and we will try to give some fresh second opinions and fresh second options to try to reverse your situation. For this woman, that means reversing the cancer in her vagina, stopping the bleeding, getting her back on a better track. And another case that came in yesterday, a gentleman, 82-year-old black man, widowed, very cachectic, means he lost lots of weight since April. He was in another hospital. We're not a hospital, by the way. We're an outpatient facility. We believe that most people want to be out of the hospital. They want to sleep in their own bed. They want to enjoy their own house. They want to enjoy their own surroundings. Yeah, come in and get treatment. Get treatment at a lower cost. Try to avoid all the complications of hospitals, all the unnecessary procedures and jams and noise and chaos. Come in where you're the boss, not the drug company. That's us, a private center where you are the boss. Well, this man was worked up. He had CAT scan, bone scan in April at this hospital, and he was sent home with no treatment, losing 50 pounds, in pain, can barely walk. Can you believe it? He was in the hospital 2 weeks. He was sent home with no answer. He came in one day yesterday. We got fully examined, complete history. We staged up his whole body, found cancer, mapped out the radiation, going with treatment, and taking care. Both of his kidneys were blocked, and he has metastasis to the liver. He was never told about any of this. Wow. So what do we believe in? We believe in getting to the bottom of the case, telling the patient honestly, giving the patient and family copies of the record so you can go home and analyze your own situation, not hiding things, telling you the truth, and relieving pain and suffering, stopping bleeding like in the last patient. So for this gentleman, I believe we can help him a lot. I believe we can reverse the cancer. I believe we can most likely take away the pain. Of course, there's no promises, no guarantees in medicine, but most likely that will happen. So you might want to come in too if you wish. I got a call, kind of an emergency call yesterday from upstate New York, the Binghamton area. A patient called, actually the daughter of a patient called. She said she called 2 years ago, but she said, quote, "I didn't know cancer could grow in the elderly," she said to me. She said she sent for information. She spoke to me 2 years ago and said she didn't know cancer could grow in the elderly. Well, what does cancer do? Cancer's got one job. That is, it's to grow, whether you're a baby, a child, an adult, older. The cancer's job is to grow. Now they're in trouble. Now they're in pain. They're going to pop in their car on Monday and drive down for a consultation to find out exactly what's going on and how to remedy their situation. Yes, cancer can grow in the elderly. Yes, please don't wait. Please, it's not going to get better by itself. And here's an interesting story. This is a man who came to us last week with kidney cancer. I spoke to you all about him last week a tiny bit. He had a nephrectomy, which means removal of the kidney. At that time, he went to another hospital in one of the boroughs of New York City. They found the cancer had traveled already, yet nevertheless they removed his kidney. Then he had metastatic cancer. He went to a big cancer hospital. He had 4 different experimental regimens over the last year. None of them worked. Hey, he came here. We spent an hour. We talked about everything. And then he ran out. He didn't even give his insurance card. Wow. He thought he was cheating us. But then we got all his documents from Sloan. Oh, shoot. He got all his documents and found the cancer was growing. Well, cancer's growing. It means the treatments don't work. And experimental protocols usually are for the benefit of the pharmacies, drug companies. They're looking at new drugs, but that doesn't mean they're really necessarily designed to help the patient so much. If they help the patient, great, but the main goal is to investigate the drugs. We had 4 different regimens in a year. None of them worked. He's in trouble. The cancer's progressed. At this other place, he had a CAT scan in April, and then a week later in May, like April 25th and May 3rd. In 1 week, the cancer was growing. This was kidney cancer. What's our success with kidney cancer? Well, we've just looked at the data. Actually, my son analyzed the data for kidney cancer metastatic to the lung, and the success rate in stopping or shrinking kidney cancer to the lung is 97% for the rest of the life of the patient. It's very high success elsewhere in the body. This man has metastatic kidney cancer to his lymph nodes in his chest. Most likely we can stop it. He can stop a year of what turned out to be useless clinical protocols, chemotherapy, and other treatments. So he came back this week wanting to have radiosurgery. He thought it over. He thought about our conversation. He read the literature. We have a book that we'll mail to you if you want, but we gave him our book and our DVD. And he understood the rationale of treatment, that systemic treatment was not helping him. Even if it helps, it only helps the minority for a relatively short period of time for most. Radiosurgery, where we treat, has a high control rate, usually about 90% for kidney and other cancers. We do treat cancers in the kidney and also where it spreads, whether it's lung, lymph node, adrenal, liver, bone, brain, or elsewhere. So this is the end of the show nearly. If you have questions, please feel free to call me at 212-CHOICES. We'll mail you that booklet DVD. Our next shows are tomorrow. We have 4 new shows tomorrow on WOR, which is 710, one at 1:30 to 2:30 a.m., one to 3 to 4 a.m., 6 to 7 a.m., and then 9 to 10 p.m. tomorrow night. 4 shows, all 1-hour shows on WOR. Thank you for listening. I hope you learned something. If you have questions, please give me a call. God bless you, and thank you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within 1 business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With body radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, See Dr. Lederman, 212 Choices. 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 212